Hi, my name is Janet Piga and I'm taking up nursing leadership and management. I want to share with you what I have learned in critical thinking, nursing in theory and practice. Our profession as a nurse requires us to think systematically and logically ahead to plan and solve problems. We use the nursing process as a guide in making correct decisions that provide safety to our practice. We use our critical thinking skills in every day of our lives, even in decision makings in our personal lives. We apply critical thinking skills in the process of solving health problems of our patients and making decisions with creative thinking that improves the outcome. According to Peter Fashel, critical thinking means good thinking, almost the opposite of illogical, irrational thinking. Nursing practice has an intellectual and professional standards that we are bound to follow. It is guided by the code of ethics and standard ethical behaviors. Practicing this using the nursing process also requires us to have an attitude of having confidence in thinking dependently towards a problem-solving situation. We are able to take risks and practice being fair. It requires us to have a discipline, perseverance, creativity, curiosity, integrity, and being able to be accountable to our actions. Knowledge as nursing professionals was based on evidence and practice. This prepares us to anticipate and identify nursing problems. Our knowledge will enhance and improve as we go through the transition of our nursing career and practice our profession. Through our clinical experience, we acquire decision-making skills and we gain competence as we use the nursing process to guide our planned decision, what intervention are we going to use, and in evaluating our actions. We've learned that critical thinking provides the skills to analyze and evaluate a given challenges that we encountered at the workplace. Improving the clinical thinking skills will provide safe patient care and help in quality improvements. In the nursing clinical practice, we apply our clinical reasoning and clinical judgment for a safe, efficient, and skillful nursing intervention. Our clinical decision making relies on the best option for providing total care for our patients. We are anticipating what is going to happen, we act on the situation, and we reflect on our actions all the time. Verbal and nonverbal cues that we may encounter upon assessing our patients. We go through the process of drawing conclusions related from the subjective and objective data that we collected. Practicing therapeutic communication also builds trust and rapport to our patients. It allows us to understand and connect with our patient. Having a connection to them will result in improvement in gathering more information that are relevant in data collection for the implementation of our care. According to LeBlanc, critical thinking plays an essential part in the role of nurses in giving quality nursing care. It aids in prioritizing their needs through a systematic assessment and knowing what affects the patient.